Good afternoon, everyone. My name is Rotana Sagaf. I'm a Senior Program Officer within PCORI's Clinical CR Unit, and we'll present the overview of PCORI's Cancer Partner Funding announcement. As many of you may be aware, PCORI releases several funding opportunities annually, which include broad PCORI funding announcements, or PFAs, that solicit investigator-initiated CER topics, as well as focused funding opportunities that are informed by PCORI's list of topic themes. Cancer has recently been added as a priority topic for PCORI, which led to the development and release of this Cancer Partner PFA. This PFA was developed with significant input from patients, caregivers, clinicians, advocacy and clinician organizations, researchers, health systems, payers, policymakers, and other funders. And it calls for CER that is jointly led by research and community partners to focus on advancing care and outcomes across the cancer care continuum, with the goal of really informing health decisions for patients, caregivers, and communities experiencing high burdens and practice variations in cancer care and outcomes. This PFA allows direct costs per project up to $12 million for both research and peer review costs, and a maximum research period of 5 years. An additional year and up to $13 million in direct costs may be considered for studies that propose and justify powered patient-centered primary and/or secondary outcomes at or beyond 24 months post-intervention. I'll go into further details about the parameters of this PFA in later slides. This funding opportunity includes 3 special areas of emphasis that are really meant to encourage submissions to these areas, but not limit submissions to these areas of focus. And these include addressing barriers to recommended cancer screening and timely follow-up in the general population, as well as among individuals at high risk of cancer, improving the delivery of patient-centered evidence-based care during cancer treatment, and addressing the post-treatment follow-up care needs of cancer survivors. Please note that no additional funding or higher priority is allotted to these areas. You will be asked when submitting your LOI to indicate whether your LOI pertains to one or more of these areas of emphasis. As previously stated, for this PFA, proposals must be led by a core partnership between a research and a community organization that are jointly leading the study. Therefore, applications must include dual principal investigators, or PIs, one PI from a research organization and one PI from a community organization. Both organizations must be US-based. These organizations, the study proposed is to address research questions or decisional dilemmas currently faced by the communities that are participating in the study. This lead partnership is referred to as the core partnership. While an existing partnership between the core research institution and community organization is strongly encouraged, the 2 dual PIs from the research and community organizations are required to have previously collaborated with each other on research and/or health initiatives. Demonstrable evidence of prior established partnerships will be required at the time of application. The PI from the research organization must also have demonstrable prior experience in conducting community-partnered research studies. The community organization in the core research community partnership must have demonstrable prior research experience and/or experience in implementing health initiatives in community settings. Beyond the core research community partnership, applicants are also required to engage with other organizations that represent the appropriate range of expertise and knowledge of the population of interest that is needed to carry out the award successfully. This partnership is referred to as the broad coalition of community partners. And this includes organizations that are helpful for the sustainability and scalability of the interventions, such as health system leaders or public or private payers. All of this is outlined clearly in the PFA, so you can refer to that for additional details. To facilitate the generalizability and uptake of findings to community care delivery settings, the inclusion of patients receiving care from non-academic community clinics and hospitals is strongly encouraged. Additionally, leveraging existing research infrastructure, coalitions, and/or networks, including but not limited to PCORNet, which my colleague Juliana will describe in later slides, are strongly encouraged to enhance research efficiency, participant representativeness, and dissemination and adoption of study findings. Finally, developing a clear plan for shared leadership, detailed roles and responsibilities for the core, as well as broad coalition of community partners, a plan for sustainability and scalability of the interventions beyond the study period, as well as plans to travel for annual in-person meetings intended for peer learning among all Cancer Partner awardees are also required for this PFA. Community organizations eligible for the core partnership are defined as non-federal, non-academic, non-research organizations that provide services, support, resources, or advocacy to members of a defined community. Communities may be defined by several characteristics, including geography, clinical indicators such as cancer type, cancer stage, family history, patient socio-demographic variables such as diagnosis or household income. Community organizations are also expected to address the health care-related and/or psychosocial needs of individuals and communities in the U.S. experiencing high cancer-related burdens and practice variations in cancer care and outcomes. Examples of eligible community organizations include those that provide services in community settings, for example, transportation, nutrition, physical activity, home health care, social, vocational, educational, and/or financial support, faith-based organizations, as well as patient, caregiver, and/or condition-specific advocacy organizations. Non-academic, non-research healthcare delivery organizations, such as community hospitals and clinics, or federally qualified healthcare centers that demonstrate a focus on understanding and addressing the psychosocial needs of the communities under study, in addition to their healthcare-related needs, may also qualify as community organizations. Governmental organizations at the local, regional, tribal, or state level and their respective departments of public health are also eligible to serve as community organizations. Healthcare delivery organizations that provide both medical services and insurance coverage, however, are not eligible to serve as community organizations in the core researcher community partnership. Please note that research and community organizations proposed for the core partnership are expected to be distinct, separate organizations. Described here are the research considerations for potential applicants. PCORI is interested in communities experiencing greater cancer-related burdens and/or practice variations in cancer care and outcomes. Populations of interest include individuals eligible for cancer screening who may be at an average or high risk for cancer, individuals receiving curative or non-curative treatments for any cancer at any stage, cancer survivors who have completed treatment, as well as family caregivers. This funding announcement calls for CER comparing 2 or more clinical or system-level interventions that are existing or in widespread use to address any phase across the cancer care continuum. While not required, applicants are strongly encouraged to propose multi-level and/or multi-component interventions where comparators include, in addition to healthcare delivery-related components, a focus on community-focused drivers of health such as social, psychological, and behavioral factors. These include, but are not limited to, transportation, language barriers, lack of awareness or education, health beliefs, attitudes, and health behaviors. Applicants should include validated primary outcomes that are patient or caregiver-centered, clinically meaningful, statistically powered, and important to the communities participating in the study. Because of the high burden associated with cancer, inclusion of at least one secondary outcome focused specifically on patient and caregiver burden or economic impacts as described in the considerations of full range of outcomes data in PCORI funded research section is strongly encouraged. I will share additional details in a later slide related to these outcomes. Depending on the research question, PCORI is interested in both long and short-term outcomes. When possible and appropriate, powered outcomes at 12 months or longer are strongly encouraged. Studies proposing powered outcomes at 24 months or longer may be considered for additional time and funding as described earlier. Appropriate settings for intervention delivery include, but are not limited to, outpatient clinics, inpatient settings, primary care practices, community-based organizations, and patient homes. The proposed settings should be representative of sites where the targeted population typically receives care. As previously stated, to facilitate generalizability and uptake of findings to community care delivery settings, inclusion of non-academic community clinics and hospitals is strongly encouraged. Applicants are required to propose individual level or cluster randomized controlled trials. Observational study design will not be considered responsive for this funding announcement. Applicants are expected to pay special attention to issues of intervention implementation with an aim to facilitate widespread uptake of findings after the completion of the study. Therefore, the use of hybrid effectiveness implementation approaches is required for this funding announcement. Please note that if proposing a hybrid type 1 or 2 design, proposals must include a primary aim focused on a patient-centered CER question and a validated statistically powered patient or caregiver-centered comparative clinical effectiveness outcome as one of the primary outcomes. Hybrid type 2 studies must also include one validated statistically powered co-primary implementation outcome. For hybrid type 3 trials focused primarily on implementation outcomes, those also must include at least one validated statistically powered primary implementation outcome and one validated secondary patient or caregiver-centered CER outcome. Please note that strict implementation or dissemination studies will not be considered responsive, nor will studies focused on the development of research methods. Research funded by PCORI must adhere to PCORI's methodology standards. These standards represent minimal requirements for the design, conduct, analysis, and reporting of scientifically valid patient-centered CER. On the left are 6 cross-cutting standards that PCORI expects all applicants to fully implement. Please note that the first standard for causal inference methods is also considered cross-cutting and applicable to all patient-centered CER. The standards on the right represent study-specific standards, but I wanted to point out the standards on studies of complex interventions that may be particularly relevant for this PFA, as this PFA strongly encourages multi-level and multi-component interventions as previously described. As appropriate, PCORI-funded research shall consider the full range of clinical and patient-centered outcomes data that are relevant and important to patients and members of the broader health and healthcare community. And as I stated earlier, because of the high burden associated with cancer, inclusion of at least one secondary outcome focused on patient and/or caregiver burden or economic impact is strongly encouraged for this PFA. However, please note that PCORI is prohibited from funding research for which cost and economic impacts are the primary outcomes. Outcomes that develop or employ dollars per quality adjusted life years or quality measures or cost effectiveness, cost benefit, or similar economic analyses are also prohibited. Please refer to the resources on this slide for additional information. This slide further outlines what is allowed, including data collection on cost burdens and economic impacts relevant to patients and caregivers versus what is not allowed, including formal cost effectiveness analyses, direct comparisons of the cost of care between alternative approaches, or cost simulation or modeling to develop total costs of care. The resources on the previous slide will provide additional detail related to these outcomes and analyses. For this funding announcement, applicants are permitted to request PCORI funding for patient care costs. Please note that PCORI defines patient care costs broadly to include the cost of interventions and their delivery. Coverage of patient care costs is not guaranteed and are considered in cases where lack of coverage will pose critical and unmet needs meriting the study, pose significant impediment to study participation, and cases where the sustainability of the study findings after the completion of the study can be accomplished without continued research funding support. Seeking funding or co-funding from a third party is strongly encouraged to further demonstrate the likelihood for future sustainability and uptake of the study findings.